Aging in Style is sponsored by UConn Health. Here for you then, here for you now.
When a loved one seems to be forgetting things more often, how do you know if it could be Alzheimer's disease?
We visited the James Walker Memory Assessment Program at UConn Health, where they are helping families get answers. Take a look.
Treating a loved one for memory problems is complicated. That's why the UConn Health Memory Assessment Program brings the best doctors from different fields together under one roof at the UConn Health Center in Farmington. Dr. Christina Zdenise is the co-director of the UConn Memory Center with Dr. Yazid Magaida. She's a psychiatrist specializing in older adults.
For families who want to send their loved one where a place they can get answers, it's nice that you have this whole team under one roof investigating your loved one's care.
Exactly. So it would be very easy to just, go in the community to an individual physician and get a consultation and have some sense of what might be going on. But I think it's helpful to have a bunch of minds, strong people in the field coming together to talk about what might be going on that one physician didn't think of. So sometimes the geriatrician might have one idea, the geriatric psychiatrist might have another idea, and a neurologist might have a third idea. And it's when we sit down and discuss how our patients are doing and what symptoms they're presenting with that we really come to answers.
While Dr. Zdenise focuses on the mind, Dr. Yazid Magaida is a geriatric physician. He focuses on the body.
When the patient comes to see us, we look at the big picture. We don't want to just zoom down and talk about the memory loss or whether this is dementia or Alzheimer. We want to first just try to understand what's happening with the patient, what is the background, what are the other medical problems she or he is dealing with.
Both agree treating memory loss is a family affair.
A very important part we do in our clinic is meet the family or the caregiver. Get something we call informant interview, trying to understand the problem from a different perspective.
The memory program provides a complete evaluation to determine the cause and the treatment for memory loss.
What are the signs?
So, I think everybody gets a little bit more forgetful as they get older, and even younger adults might sometimes feel scattered and forgetful if they have a lot of stress going on. So not all forgetfulness is dementia. Where we describe dementia is when patients start having memory changes that affect their day-to-day functioning. So maybe they're starting to forget to take their medications over and over again, and then their blood pressure's out of whack. Or maybe they're getting confused while they're driving.
What's the difference between dementia and Alzheimer's?
That is a great question. So dementia is an umbrella term. It describes patients who have had memory changes that have developed over time, started to get worse, started to impact their day-to-day functioning. Alzheimer's disease is the most common form of dementia. Depending on the statistics, we estimate anywhere between 60 to 80% of dementia falls in the Alzheimer's category, and that relates to specific changes in the brain.
We know there's no cure for Alzheimer's, but what do you do here that's different, that you can give families hope?
Well, first of all is give them accurate diagnosis, help them understand what's happening.
While there is no cure for Alzheimer's disease, doctors here want you to know heart health is brain health. So getting plenty of exercise, eating right, and keeping cholesterol and blood pressure in check is important. Age is the #1 risk factor.
About 40% of older adults 85 and over have evidence of Alzheimer's in their brain.
What's the most exciting thing you've seen come in the new research recently?
Well, in terms of early detection, recently there have been some studies showing that we might have some blood biomarkers, meaning we can do a blood test to pick up on proteins that signify that in the future somebody may be at risk for Alzheimer's or other forms of dementia.
Yeah, so if you think you need help getting that accurate diagnosis, the James Walker Memory Assessment Program at UConn Health is accepting new patients.
For more information, go to healthucon.edu/aging/memory-assessment-program. That's very, very important information.
Yeah, so it's a great place, great resource for families out there right here in Connecticut.